I just can't believe I had open heart surgery a week ago. Yeah, it's amazing. It's just amazing. Yeah.
Steve Nicklin had a heart problem. His mitral valve was leaking. So he traveled all the way from Washington, D.C. to Indianapolis to meet Dr. Mark Gerdish and his team here at Franciscan Health Heart Center.
We can repair that valve, and the vast majority, better than 90% of those patients, will never need anything done on their valve again. And they go back to a normal functioning valve, which puts them back in normal function, which actually restores them to a normal life curve.
I don't use this term loosely as a miracle worker.
A leaking mitral valve can cause blood to flow backwards, causing chest pain or shortness of breath.
And Dr. Gerdish specializes in what's called a thoracotomy, and that's where they go between your ribs. So they don't break anything. All they do is they go between the ribs and they separate them so they can access the heart. And the really cool thing about this procedure is it offers a much quicker recovery time.
Quicker and nearly pain-free, as doctors can freeze the nerves near the surgery site.
And we have an area that remains somewhat numb for about 2 months, and it just comes back. It always comes back. I've never had anybody complain about the numbness, and I have yet to have anybody complain about not having pain because it's gone. We don't see it anymore.
Steve's story has gone viral. After HeartValveSurgery.com shared his recovery photo on Facebook, it reached more than 60,000 caregivers and patients.
Some of them want to know how to get in touch with Dr. Gerdish, and I sat in my hospital bed and cried when I read some of that stuff because some of the messages were just so generous and loving and supportive, and it was from people, of course, who I'd never met.
When I see patients in the office, sometimes we both have tears welling up in our eyes because they've had such an incredible experience in the institution. That has very little to do with me because they were asleep when I saw them mostly. It has to do with our nursing staff, the intensive care unit, all the patient care elements that happen at the institution.
Learn more about Franciscan Health Heart Center. You can go to franciscanhealth.org. Jason Heath, Boomer TV.